Hi everybody, I'm Jarvis Greer. You may have seen me on television or back in the days when I was a tiger running around with the University of Memphis, but this is my story about my bout with cancer. It started about 26 years ago when I was in my 40s, and I noticed that I had starting to have difficulty going to the bathroom, peeing. And went to the doctor, and he said, yeah, we'll check your PSA. And we'd heard about, prostate and all that business, and that when you get older, that sometimes you have a little bit more difficulty going to the restroom, and I just hung it up on that and thought that was it. But as the years went on, it became more difficult and more difficulty going to the bathroom, and my doctor, who had prescribed for me some of those prostate medications, they worked for a while until they didn't. And that's when they started really concentrating on those PSA tests. And then one day in 2020, what a heck of a year 2020 was, huh? That was, not only was it the COVID year, but it was when I got my diagnosis. I had gone in to get a regular PSA test and came out and was about to leave to go to work. And the doctor ran out after me and said, hey, look, we need to test this again. And they did, and he said, I think we need to send you to a specialist, a urologist. And I went to the urologist and went through all that, and they did a biopsy, and they said, yep, it's cancer. And they gave me a couple of choices. I could do the Gamma knife thing, which is like an outpatient procedure, or I could go through the Da Vinci thing and have the whole thing taken out. And I was going to go with the Gamma knife because that seemed like the easiest thing and the less thing to hurt the old belly there. But we went and got a consultation at St. Francis Hospital, and they had question marks on their faces whether we should do that. My wife, who worked at St. Jude at the time, she gathered with the doctors there and said, nah, you need to go get that taken out. We need to be sure about this. And so we went to Vanderbilt, where prostate cancer is what they do, and ended up my cancer, my prostate, was the size of a grapefruit. It was the largest that they had seen. And they even had to put stents around my kidneys to make sure that they wouldn't cut something dealing with that, because it had grown so large in there. And 6.5 hours of surgery, I got out, come back home, was able to get up and walk around pretty much the first couple of weeks, and had the stents taken out about 3 months later or so, and was able to go back to work. And man, I tell you what, when they took those stents out and the doctor said, yep, we think we got it all, that was the best thing ever. I was actually able to pee like a 6-year-old. It was awesome, let me tell you. And I just want to be frank with you. It's something that you really need to check with your doctor, get your PSA checked, get all of that stuff done, because you never know what could be going on inside there. I consider myself pretty healthy. I'd been running and exercising and all that kind of stuff, and eating pretty good, but you never know. Anything can happen at any time. And it's just such a great blessing to be honored by this organization. And the Jerry Finney Courage Through Cancer Award is just something I never did ever fathom, couldn't think about. And I'm so happy and proud that, the city that I call home came and was very, very much in my corner when it came to my recovery. Of course, my wife and my family. I love you all, and I love you all for giving me this award. I cannot think of anything that I did myself to deserve it, other than try to stand up and talk to the people about cancer and getting yourself checked. Please get yourself checked. Do what you need to do, because this is a killer. It could take you out. Could have taken me out, but I'm still here. And I think that's the best testimonial that I could give anyone. Thank you all very much.